I thank you, everybody, for coming.
Thank you. Yeah. Nice event.
I'm so delighted that you came. Stephanie, sweetie, thank you. All right?
And then this is her tumor.
It's the people. It's the people that care about you so much that are willing to keep looking.
You have been helped to this point, but you're not where I want you to be.
When something looks just a little bit off, they will keep searching, they will keep looking until they find what is wrong, and they take care of it every single time.
This is actually one of these cases in where we are removing a tumor, a very complex.
I was diagnosed with a craniopharyngioma, a tumor that had surrounded the stalk between my hypothalamus and pituitary gland and wrapped itself around the carotid arteries and was applying pressure to my optic nerves.
And I noticed what I thought was a blind spot when I was driving.
I had the pituitary tumor.
All of a sudden I had started gaining a lot of weight. I was very anxious, very nervous all the time. My hands and feet were numb.
I had an MRI a few weeks ago, which showed that I had a tumor on my pituitary gland.
The pituitary, that's why we're all here. The pituitary that we call the master gland. And the pituitary is located, as you can see, in the bottom of the brain, and it is attached to the brain by a stalk, and the part of the brain that it's attached to is called the hypothalamus. Here's the pituitary right here.
In the 1900s, here at this institution, that Dr. Cushing, as you can see in green right here, did his first pituitary surgery.
As Dr. Wong told you, the pituitary controls a lot of glands below the neck. The thyroid, the adrenal glands.
The first day was about an 8-hour operation, and the goal of that surgery was simply to remove the bone, was to do the bony work, to drill out to get enough exposure. He came back the second day, and we took out that tumor completely, and he walked out of the hospital the next day.
If you imagine this is your pituitary tumor or pituitary tumor cells, and let's say this is your normal tissue around it, let's say your brain and your vision nerve, you hope to deliver radiation right to the tumor to kill the tumor without touching the normal cells around it. And that's the principle of stereotactic radiosurgery.
The goal is to replicate in mice what we see in the patient.
The most important thing for us is obviously our patients' outcomes and how well we try to make sure that you do well after your management of any pituitary disorders, either through medical management or surgical management.
It's good to be in a center where you have, you know, a whole team, like they were saying, a village of people that can actually, that you can talk to and interact with.
The bedside manner of these doctors is phenomenal.
You gotta come back and see me. You look good. Your mom came with you or not?
Yeah, she's fine.
It's like nothing I've ever seen before. And I mean, they're brilliant, you know, and they're as friendly as they are brilliant, you know, and just very, it just has been a wonderful experience.
I would like to congratulate Dr. Salvatore and Dr. Quinones for organizing such a spectacular event where we're able to interact outside of a clinic room inside the hospital and actually share with you some of our views in terms of how we treat pituitary tumors.
We really feel that this is a team effort, and as you can see, it just really takes a lot of people to put these surgeries and not only the surgery but the medical management of your pituitary disorders and to implement them. And we're very honored to be part of that.
Very family oriented. You feel like that, you know, they care about you, that you're not just a number.
I have learned so much. This was so worth it. Everything was explained, you know, at a level that you could understand.
You know, she looks great. I'm just so proud of you.
I'll see you in November.
Yeah?
Yeah. I'm going to try to make one of those appointments.
I know.
Yeah.
You know, your family was right behind you the whole time.
I know.
You know?
I brag about them all the time because I don't know if anybody else could have done it as well as they did. They are a fabulous team. They know how to make you feel comfortable. They know how to speak to you in your terms.
I made the remark to my wife after our initial visit with Dr. Quinones that it was the first time that I felt like a person and a patient. Prior to that, I had been treated as a tumor and a case to be solved by other surgeons.
It's very, very good. I mean, you feel comfortable. You're with people that are on the cutting edge and that know what they're doing.
I'm gonna get emotional. I think it's the best thing, saved my life. And the one thing that I've had the privilege throughout the past 4 years is to meet so many people from different countries, from different areas in the United States that have Cushing's disease. And I always tell them that Johns Hopkins, you can't find a better place to go.
I feel truly blessed that I was given the opportunity to be treated at Hopkins.